Hey, Dr. Eric Blazinski here, Fanwood Back Relief Center. I hope you had a great holiday with your family and your friends, and I want to wish everyone a happy new year. We are in the office today, a normal week, and we'll be closed normally like normal Friday, Saturday, Sunday, and we'll see you next Monday, normal schedule again. Today I want to talk about why women are more susceptible to knee injuries. Obviously there's differences between the anatomy and physiology between men and women, but one thing that's overlooked is knee injuries. In fact, women are 2 to 8 times more likely to injure their knee within their lifetime, and there's reasons for that. Let's talk about a few of them. When it comes to the lower extremities, an issue in the foot, ankle, hip, knee, or lower back can cause one to move differently. What we see is biomechanical changes in the way somebody walks based on structure, loading, and function. So we're going to talk about some of these reasons why women are at elevated risk. Number one, let's talk about the feet. Women have greater mobility in the ankles, increased flexibility in ligaments in the lower ankle and foot, which can cause higher risk for ankle sprains. Women's arches are flatter, so they pronate their feet more when they walk, which can increase the risk for heel pain, plantar fasciitis, tendonitis, bunions, calluses, and more. Additionally, footwear choices such as high heels also can alter the biomechanics of the foot and can change normal joint motion elsewhere along the whole kinetic chain. So these are some differences. Another difference is women generally have wider hips. Mainly to bear children. So these wider hips cause a greater angle of the femur, the leg bone, into the knee, causing more stress in the medial or inside part of your knee. This what we call knock knee or genu valgus, which can cause a greater incidence of ACL tears and kneecap patellofemoral pain syndrome, kneecap pain as well. Both of these are a lot more common in women than men. Now, these are just some of the anatomical and physiological differences. Of course, as a chiropractor, I cannot change that. But what I can change is to make sure that things are balanced and symmetrical from the hips all the way down to the feet, from the hips all the way up to the head. So when there's differences in altered posture or alignment, it adds additional stresses, creates imbalancing, asymmetries that can cause more loading on one side more than the other, and actually can make some areas that are already stressed even more stressed. So it's important that balance and symmetry is number one, is key when patients come into my office, and number two is I want to make sure everything's functional or moving properly, because if a joint is restricted, an area is restricted, then it's not going to move properly and it's not going to have the normal healthy function that it should in order to maintain the joint mechanics. Hopefully this makes sense. Hopefully this is of some value. If you are suffering with knee pain, or if you would like some information on how to avoid developing knee problems, you can just shoot me a message anytime, give us a call, come in for a consultation. We're always here and happy to help. That's all we got for today. Hopefully you enjoyed the video, and we will talk to you next time. Happy New Year.